So guys, welcome to this interview. What do you know about sports medicine as a GP? I'm Dr. Arora from Arora Medical Education. I get asked a lot by trainees about sports medicine. It's something that fascinates a lot of people, and there are a lot of questions that come my way that I don't really have the answer to. So I'm really, really lucky to have two GPs, both involved in sports medicine, both in different ways, in different formats, have different stories. And I think this interview hopefully is going to give you some answers to some questions that you might have and open up this field as to what is really an exciting area, I think, that a lot of GPs are starting to look into. We've got Dr. Naheem Ali, who's doing a lot of sports med right now. I think your main roles is Millwall FC and Milton Keynes Lightning Ice Hockey at the moment. So welcome, Naheem. And we have Usman Sajjad, who finished in August 20, so quite a recent finishing GP, whose main role at the moment is with one of the rugby league teams, Witness Vikings, isn't it, Usman?
Yeah.
And also done a lot of work in boxing and worked with Everton as well. So welcome to both of you. Naheem, I'll come to you first. Thank you so much, buddy. We met probably a couple of years ago, long back in your previous life as a GP trainee.
Yes, we did. It was a pleasure to be on your course, and it was very useful.
Good. That's a distant memory now, but you're doing some super things. And Usman, we haven't met face to face, have we? But we did live fairly recently.
Yeah. So we met on the live, but we haven't had the pleasure of meeting face to face. No,
we will, I'm sure, one day. And Usman does a super podcast, by the way. We'll put the link to that as well down below. We did some super interviews. So thank you guys, firstly, for taking the time out to do this. I think hopefully it's going to give some value to a lot of people. I just want to go back in time a little bit to start with. We'll start with you, Naheem, first. When did the thought of sports med first come in, and was it something that you just thought about fleetingly, or did you have a plan to go there right from the beginning?
So my path is a little bit atypical. I actually started as a trauma and orthopedics training. So after completing my foundation training, I went to core surgical training, did that, and ended up in Stanmore in North London doing orthopedics and a bit of research. So it's really when I was doing my research and doing orthopedics, I got married, I got one kid, second was on its way. So I kind of thought to myself, I don't think I can do this for a long, long time. So essentially being a trainee, I wanted to get to my end goal as soon as possible. And general practice was offering that. It was a good opportunity to get into training, and get qualified quite quickly. And I made the switch around that time. I think it was 2015 or 2016, if I remember. And I was really lucky because as soon as I got into general practice training, I met a girl who was working for a football team, and she was about to go on maternity leave, and she asked me if I could cover for her.
Oh, wow.
So I joined Barnet Football Club at the time as an ST1 in general practice. So the requirement at that level, so they were playing at the time in League Two, which is the fourth division of football. The requirement was that, as a doctor, you have to cover only the home games. And you have to be available pretty much 24/7 on your phone if the physio or anyone from the team needs advice or guidance. I started my training and I joined Barnet, and it wasn't really like I thought about going into sports medicine, but when I got into this, I felt this could be a good option for me, especially with the trauma and orthopedic background.
Yeah. So it wasn't like a burning desire from the beginning. It kind of evolved through the opportunities that gave you yourself in as a GP trainee.
Yeah, it was probably a good way of utilizing the experience and the skills I had gained over the years. Whether it was sports and exercise medicine or whether it was being a GP with a special interest in MSK, I think both routes were appealing for me.
Okay, brilliant.
I had done a lot of spine surgery because that's what I was interested in, and I know a lot of people run away from back pain, and for me it was something I found really interesting, and I wanted to get involved with. So.
Wow.
So even as an ST1, I remember being in my practice. Sometimes I had morning surgeries with just back pains because everyone knew that this guy just loves them. So
yeah. Wow. So kind of indirect way in then, I guess, for you, Naheem. Usman, what about yourself? Like when did the sports med thing first hit your mind?
Well, I boxed competitively as an amateur between 2010 and 2014. I still do it for fitness now. So, but then even in med school, strangely enough, I always wanted to go into elderly medicine, geriatrics,
Yeah.
which is completely different to
Yeah.
sports.
Yeah.
Um, Started my F1 and I just couldn't bear doing night shifts, weeknights. I did a medical SHO job as an F2 and didn't really enjoy it.
Yeah.
But my first job as a GP during F2, I told my supervisor, I box competitively. I wonder if there are any jobs that we can work as a doctor at games. Because I've seen some doctors when I'm there. And he's, oh yeah, there's obviously you can become a GP with a specialist interest. So he actually had me shadow the Everton Academy doctor at the time. One thing led to another. Obviously, did a bit more reading, find out a little bit more about it. So from 2015, I registered with England Boxing to work as a doctor at the amateur boxing events. And then from there, I just did a bit more reading and found out, got to do a diploma. So I started my sports and exercise medicine diploma at Bath University in 2017. Delayed it. I've just got to do one more year from this December because I just delayed it because the GP training got a bit difficult.
Yeah.
And then it's basically just that really you get in and then you meet one person and then you meet someone else. So like I said, I was saying to Naheem before, Dr. Ali before, worked in football for a season just due to the guy who I shadowed initially 2 years previously saying that they were looking for a job in women's football. Yeah. And then from there, you might meet a paramedic or you might meet someone that knows someone else. And then that led to my work in the rugby league.
Yeah.
So it's all about contacts really. And it's not a very conventional way of getting in. And, in terms of you start this training program, you split it to exams, it's about, you go to these games, you shadow someone, you meet someone else, it's all about it. Sadly enough, it's about who you know, but you're only going to get into that position from shadowing and making connections. So that's really my way in, really. And I thought about doing there's a 4-year training program, which we'll talk about the sport, and I decided against it. I'm just happy doing the GP and the sport to the side.
Yeah. And that's really interesting because both of you, by the sounds of it, came into it in your GP training years, right? Yeah. By different routes, which is fascinating because I get a lot of GP trainees asking me about sports med, and I'll be honest, I don't really know how to get in. What do you do? The diplomas that you mentioned, and who do you contact? So let's start with a trainee comes to me and says, "Look, I've got this interest. I don't know where it's come from. I haven't looked into it, but I think it might be for me." Yeah. I'm a current GP trainee. Number one, can I start doing something or should I start doing something as a GP trainee or should I wait till I've finished? Yeah. And B, if I do, where do I go? Who do I turn to? What's the first route? Those will go you first and then we'll come to Naheem.
Yeah. So, I mean, my advice would be, and I tried to get ahead of my time and, try to do it all quickly. I'd finish your GP training first. Okay. There are certain sports, and I know Dr. Ali can sort of vouch for me, where you have to show some evidence of doing a diploma and the courses. There's an APMIF course like rugby and football, but other sports like boxing, you don't have to have done anything. They just doctor. But my advice would be to try finish your GP training first because the diploma itself, I know it's distance learning, but you're still required to do essays and assessments and go for a residential week. So I found it hard to manage, especially in my GP ST1 and ST2 years.
Yeah.
So I'd say in that period of time, maybe just work on shadowing. If you can be employed in certain sports like boxing, then you can do. But finish your GP training and then think about doing a diploma.
Okay.
When you've got a bit more time, maybe from GP ST3 when you've got the exams out of the way. But I definitely do think doing some higher education like a diploma from Bath or whatnot, because even on that diploma you'll meet people as well. There's message boards and participation things where you can build up contacts. If you haven't got any contacts already.
So you mentioned the diploma. Is there one diploma that's recognized or are there several that you can choose from?
There's several. Most people go for the Bath one, the sports medicine diploma, distance learning from Bath, but there's a 1-year master's in Nottingham, but I believe that's full time. So a lot of people take a year out and do that.
Okay.
There's a couple, but I think the most common is Bath. But even because the fact it's 2 years distance learning, it's quite hard to juggle with the rigorous demands of GP training, which I realised halfway through.
It's tough as it is. Yeah, it's tough as it is.
GP training is tough as it is, exams and rotations and whatnot.
Okay. Oh, and we'll come on to that in a second, because it is hard to do additional things in GP training, but people do them. It's how do you balance that up, isn't it? I guess, and do you have the drive to push through those difficult days where you have got multiple things going on? But Naheem, what would your advice be about that? Would it be that finish training first?
it's all down to personal circumstances. I mean, some people might even prefer doing it before starting with GP training. They could do their foundation year 1 and 2, then maybe take a year or 2 out to locum and maybe do a diploma or an MSc even, which is slightly better if you have it on your CV.
Okay.
And then after that, get into general practice training. I know trainees who've done their GPST training first and then took a year out to do the MSc and then got into the sports and exercise medicine training program.
Right.
So there are various routes you can choose. It's all down to what you prefer. For me, a bit like Usman, doing the SCM training was not really an option because of, again, personal circumstances. I felt that having done so much surgery and orthopedics before in my previous kind of career, and then doing my GPST and going again into training was not really an option for me. So I didn't opt to do that. But in terms of the qualification, yeah, you can place it anywhere you like. If you've got the energy and the drive to do it during your training, why not? But one thing I would say is, yeah, I think Usman was right, is about creating those contacts around you. So even if it's your local team, whatever sports you want to cover, you're interested in, whether it's football, rugby, boxing, it can be anything. Try to figure out who are the people involved in the medical side of things. So it can be the physio or the therapist working in your local team. Doesn't matter what level they're at, they always need medical cover. They always need a doctor, and try to get involved. Try to get because you will gain experience by doing it. And I've rarely heard of people just walking into a big job straight away. You have to build your CV. And if you look at some of the bigger names in sports medicine, or some of the ones who are working in Premier League teams now, most of them started with lower league clubs and kind of build their experience and reputation.
So I guess it's like anything, isn't it? It's you need to put the effort in and maybe get some rejections and maybe push through barriers that nothing's going to come easy, right? But connections, building up a network, finding out from people who have done it already. These are the kind of common themes that you'll see with success in any field, isn't it? And I guess it's the same as within sports med. So that's some really good advice. And yeah, GP training, as you guys know, is tough as it is, and trying to balance GP training, exams, life in general, family, and then another diploma, another MSc on top of it it can be tough. But it depends on, I guess, how big that passion is and how quickly you want this all out the way, I guess. Because once you've got your degree, then once you've got a diploma, for example, or your MSc, you said the MSc was a higher level than the diploma.
Yeah, so the MSc involves a research project and a thesis. So it's considered as a slightly better. If you've got the time, if you've got the drive, if you've got the energy, go for the MSc. But the diploma is the first step, I think.
Okay.
You can start as a diploma and turn it into an MSc later on, or you can even start an MSc from the very beginning.
Okay. And if someone doesn't have anything, so they just think, okay, you know what, I want to just see if it's my kind of thing. As you mentioned, that you could literally just try and contact your local sports team and say, look, can I come and shadow?
Yeah, definitely. Just shadowing them, just picking their brain when you're there, because there've been opportunity. Like, for example, there've been times where I've shadowed someone and I've got a lot out of it. And then there've been other times where, for example, I remember this one time where I went up to the English Institute of Sport to shadow the main doctor there. Not going to say his name. The boxing. And I just felt like I was just left to one of the junior doctors. I was fobbed off for the afternoon, so I didn't get anything out of it, and didn't really have an atmosphere where I could ask a lot of questions. I remember I was an F2 at the time. So you're going to have experiences like that. You're going to have experiences where you go and shadow someone and it's really useful, and you're going to have experiences where you go shadow someone and it might not be useful. They might be very busy in what they're doing, or they might just, so all in all, you have to go and shadow people. That's the only way. And you mentioned before, and Dr. Ali mentioned before, you're not going to, if you think you're going to get into sports medicine and walk into a job at Man United or Liverpool, then it's not going to happen. It's
exactly. Yeah.
It's not going to happen. You have to build yourself up. I'm compared to, the likes of Dr. Ali and other people, I'm still a baby in this thing, so you have to start off, even if it's working for a year somewhere or a few months, you have to build up your experience, and it's all about building up contacts and experience.
Yeah.
Yeah,
Yeah.
and often big clubs will have academies as well, and we often look for academy doctors. They're very part-time roles, but it's good to be involved. And for example, we have a doctor in our academy he's finished his foundation training, is doing his MSc, and is going to start his GPST a bit later. So he's kind of perfect position to be involved with the academy with us. And so try to speak to people, try to get in touch with the doctors or the physios. The physios can be very helpful as well, or like Usman said, sometimes even the paramedics who cover games have got contacts, and they can guide you a little bit as well. So
that's really useful. And both of you guys are obviously are GPs who do this as well. And Naheem, you're pretty much more skewed towards sports med, and you do some GP work, whereas obviously Usman, you're doing more GP work and you're doing sports med as well. So have you noticed that there are more and more GPs who are going into sports med? Because if I think traditionally, I would have thought it's going to be your TNO guys who probably go into it initially. But have you seen more and more GPs come into this field?
No, Dr. Ali might sort of contest here, but I haven't. And again, you mentioned some of the TNO guys, but the thing that really with sports medicine, and I know Dr. Ali can attest to me here, you give up a lot of time. Your weekends are gone. When I was in the season with this, 2 Saturdays a month, the home games were done. We're like a write-off, they're gone. And then the amateur boxing, there may be some event in the week, in the evening and on the weekends as well. So you need to be working 4 times a week on top of what you're doing. So I think in the hospital stuff, it can be quite difficult, just because of their rota and their on-calls and nights and everything like that.
Yeah.
It's fine for me at the moment, but obviously when I want to start a family with my wife, it might be a little bit more difficult, giving up times of the weekends. But I've met a fair few GPs, but I wouldn't say it's growing. Maybe the COVID situation in the last year, I don't know. But yeah.
Naheem, what do you think, GP wise?
Yeah, I think to be fair, I mean, if I look at the group of doctors we have in the championship, majority are GPs. And the younger ones, or the new faces coming through now, are SCM consultants. So traditionally, when you're attached to a club, it's usually a GP with an interest in SCM or MSK. It's just that because it's one GP or sometimes 2 GP per club, you don't have a lot of those jobs going around, and often a club might keep a GP on for 10, 15, 20 years. But now things are moving more towards SCM. And if you look at a lot of the job advertisement for bigger teams, it's often a requirement to be an SCM specialist.
So SCM means sports exercise medicine.
Sports exercise medicine, absolutely. Yeah, and it makes sense. It makes sense to have a GP on board because you're not only dealing with musculoskeletal injuries, you're also dealing with the whole body, and you can have a range of issues you have to handle. And being a GP, that's a great thing. When you're a GP, you're able to handle those things because you're.
Let me pick up on that. Actually, that's a really important point. So when you're a GP for a club or a team, are you working as their GP as a whole? Like you're their GP? Is that how it works?
Yeah. So at this level, in the championship for Millwall, I'm their GP, their doctor.
Oh wow, okay.
And like I said, I don't only look after their knee or ankle injuries.
Yeah.
In fact, I've got a very experienced physiotherapist who's been in the Premier League, and I've got a sports scientist, and they're actually probably better than me at handling those things and doing the rehab for those things.
Yeah.
I'm really there for the medical side of things, and they will need my opinion for MSK stuff, but the medical stuff is covered by myself.
Wow, so you're the actual GP dealing with their day-to-day normal general practice issues. And is that just the team members, or is it families as well? Like how does it work?
So officially it's only meant to be the team, but it's going to extend. Yeah, it's going to be. My 2-year-old's got a rash. What do you think of? And you get a picture at 11 p.m. on a Sunday, but that's just part of the job. And you know what? I'm happy to do it. It's just, because it's part of the relationship you've got with the players as well. Because you are their doctor, but they kind of trust you. And if they trust you to to manage their family or kids issues, it's a good place to be, you know. And
so wow, that's really interesting. So you're actually doing your full, even when you're not doing GP or GP sessions, you're still doing general practice, but just in a different environment. So was that the same as you at the moment with Witness then? So you're the GP for the team?
Yeah. So a lot of them, yeah. So it's essentially, and more so with the professional boxing and the boxing as well, like Dr. Ali was saying, you have them register the practice, but it turns into, oh, can my wife come and register, or my partner, or my child has this, so it just turns into, you start dealing with, like, there's a professional that, dealing with his other half's issues at the moment. And then on top of that, a lot of the professional boxers, they'll work with a nutritionist as well. So the nutritionist might get in touch with you and say, listen, are we all right to get these bloods or this X, Y, and Z? So you often liaise with other members of, so the athlete's nutritionist, or the physio at the rugby side as well.
Okay.
So I mean, that's the beauty of it. I think they can come and register with myself.
But you're a GP, which is fascinating because you're dealing with everything. And so how has being a GP helped you in your sports medicine work then? Because you're saying a lot of people don't come from a GP background, but what do you think the benefit is of having both hats, as it were?
I think the holistic whole thing, sort of treating everything really, because like I said, it's not, they have the physios and the sports scientists and the people to deal with the knee pains and the ankle sprains, but a lot of these athletes don't just suffer with MSK problems. They might suffer with mental health issues, headache, anything, rashes, anything like
normal human beings.
Just the normal young lads, the stuff that you get with young lads. So it's from that perspective you can treat them as a whole, really, and not only that, getting sort of like bloods, which are important from a performance point of view, especially with professional boxing, when they have to make weight, or, from the combat element, you finding out, biochemically what's going on, arranging scans, arranging stuff. Because a lot of times, obviously I know it's different with someone like Millwall or Everton, where everything would be arranged privately, scans and stuff like that. A lot of these professional boxers, they don't have the money to do, they have to fund everything themselves. So everything can be done through myself, within reason. So I think that's when the advantage comes from an SEM point of view, because you're able to deal with everything as a whole, health, headaches, I don't know, indigestion, everything really, everything a normal young man or young woman suffers from. Yeah.
Wow. And Naheem, your GP background coming into this, has it helped?
Oh, very useful, absolutely. I think we just talked about it, the range of issues you may have to deal with, and especially now with COVID, you're dealing with, upper airway stuff, and sometimes some of the longer effects of COVID. So it's good to have that kind of experience and work with as a GP within the NHS or it's been useful. Yeah, absolutely.
That's really fascinating, because I want to talk a bit about perceptions, and there's a great example of me not really knowing what you guys as sports medic GPs do. Like, I'm thinking, okay, you're dealing with the sports stuff, and I didn't really put two and two together. You're their actual GP, so you're dealing with the whole lot. So, and perceptions, I think, are important in modern day world. So when you say to someone, I'm a GP doing sports medicine, or a sports medic who's a GP, what kind of reactions do you get from other GP colleagues or other people that you might meet? Naheem, what about yourself?
Yeah, it can be a mixed, like a range of reactions. Often I get, oh, that's it's really easy job you've got. Basically you're paid to watch football. And although there's some truth to it, you never relax during a game, because anything can happen. And during a game, you're there for any kind of acute injuries, emergency situation as well. So whether it's a head injury or an open fracture, or whether it's even a simple injury that needs simple cut that needs suturing, it's going to be you. So you need to be quick. You need to make rapid assessments, and you have a bit of pressure as well coming from management, because time is very precious in those circumstances. But some people see me as oh, it must be really hard because the players must bother you 24/7, and again, that's not really true, because they're usually very self-sufficient, and at least at Millwall they're very robust. And they won't really moan unless there is a genuine issue. So they won't really bother me for silly things. And yeah, occasionally I'll get a call or a text very late, but that's part of the job. So there is a bit of a misconception that, you know, it's either really hard and you're always involved and you're always on call, or the other extreme where
really
you don't do anything. But it's really in the middle. You know, you're obviously you're there, you're working hard, but at the same time there is a lot of enjoyment, and it's very fulfilling as a job.
Would you back those up, or have you seen any other perceptions coming?
Yeah, I mean, mostly positive. I mean, you had the odd comment like it could be a glorified physio and all this, that, and the other. But yeah, I mean, that's the thing. I mean, you find, and I know Dr. Ali will sort of contest to this, working in ice hockey and football. I find people's attitudes, you know, athletes' attitude vary from sport to sport. I found the rugby players and the boxers are very similar. Like they're very stoic. They just get on with things. Wouldn't. I mean, you get some athletes that will call you for very trivial things. I think we find you've got to deal with how different they are. How everyone is different in this sort of sports. How they sort of deal with their issues. And again, and I found again there's huge pressures from management in football as well. You know, from returning to play and whatnot. But generally, in terms of attitudes from people, it's generally sort of positive, and they ask you how you get into it, and that must be quite cool. And you just, like Dr. Ali was saying, you get paid to watch football or paid to watch rugby or whatnot. But
so good reactions on the whole, which is a good thing.
Yeah,
good thing, but maybe lack of understanding really about what you guys actually do, and hopefully this kind of thing can help people understand a bit more about what kind of things are available if you do go into this kind of field. But what about challenges? We'll get talking about some of the difficult things then, because every job comes with its challenges, and you mentioned weekends and evenings already, Usman, but what are the other main challenges would you say are there for people who perhaps who think it's a good thing but just want to get a rounded view of what a career could be like?
One of the biggest challenges, and I know, is the difference between treating someone safely and the ethical, like ethically doing the right thing, not crossing any lines. Doping is a big issue in sport, particularly in combat sports and boxing and whatnot. So it's about doing the right thing, making sure you're not crossing any boundaries, because a lot of the professional athletes will come to you for advice. Listen, I want to take this supplement. And if you're at the end of the day, and maybe not so much in rugby because it's a group thing, but in professional boxing and amateur boxing, if you are part of that guy, that man or woman's setup, it's your responsibility to be checking what's in that drug, what's on the medication or what supplements they are, because if it all goes wrong, you'll have that to answer to. And so it's about you being a safe clinician, putting your foot down sometimes and saying, no, I can't do that for you. Knowing when to say no and when to, do things, but do things safely.
But knowing that you're a clinician first, and you've worked hard to get to the level that you are, and you've got to do things properly.
Yeah, because there's a lot of, I mean, it's probably not so much in, I didn't really find it in football and not so much in rugby because it's a lot more stringent, but in combat sports like MMA and boxing, like I said, there's a very, very fine line, the athletes and strength and conditioners and the coaches can walk in terms of doing things cleanly and doping sort of thing. So you can't be seen to participate in that at the end of the day. You can't be seen, you have to do things. So that's something I've had a very rude awakening from seeing that, basically,
Huge challenge there then. Yeah. And any others that stand to mind? We'll come on to Naheem in a sec, so I'm sure you got a few, Naheem.
I think the weekends, you think, it's all hunky dory, but a lot of times Saturday, for the rugby, I'd have to be at the games an hour before kickoff, and I have to stay 45 minutes after. So typically, the ground is about 40 minutes from my house. I might be gone from the house between 1 and 6. If I have to work in the weekday as well, I might have a whole day of work and then go 6 and then might not go home till 10 p.m. And then on top of that, if there's sort of boxing events, and then, like I was saying, you are on call, like your phone is, it's not like you have to take calls from whoever you're looking after. Yeah, and then obviously just doing the courses as well, like the resource courses, the ATMIF course, which is the resuscitation course, and other things like that. Challenges, yeah, I think they're the sort of, I think that doing things safely and doing things properly,
Yeah.
and just giving up your time really.
Time, yeah, time.
Yeah.
Would you back those up, Naheem? Any challenges on that are different?
Um, I guess he's more involved in a combat sport, and it's slightly different than a team sport. So
Yeah.
certainly the the doping issues and things that are not really present. I mean, we get tested on a regular basis, whether it's at training, they can come randomly, it can be after games as well. So um, players are very professional, very vigilant. They'll always be careful what they take. And if they have any doubts, they'll ask me. And it's very simple. You have to go on a list, and you just make
Yeah.
sure that that medication is not on the list.
Yeah.
So it's slightly different from that. From my perspective, I think the away traveling can be quite tough. So on a Saturday, it's not really an issue, but we have midweek games as well, and especially now because the season has been shortened because of COVID.
Yes.
We have a lot of Tuesday evenings and Wednesday evenings games. So we may have a game at 7:45 in Preston, which from London, it's a very long journey, and we have to drive or travel the night before, and then travel back the night after the game. So
Wow.
it essentially takes you away from your home or household for 2 days, and that's probably the most challenging bit for me. And then sometimes you get extra pressure, but that's part of the job. Be within a game, you have to assess players very rapidly, make a decision. Sometimes it can be just before kickoff or during halftime, but you kind of learn to cope with that kind of pressure. Whether it's in football or whether I've worked in field hockey as well, and I do ice hockey as well. You kind of manage that pressure within yourself, and you try to be as efficient as you can. And yes, sometimes you may have managers who don't really agree with your decision at the time, but that's only because they have their own kind of pressures on them.
Yeah. Cool.
At the end of the day, it's a competitive sport, professional sport. They have a
Yeah.
lot of pressure, and if the results don't go our way, it's usually the manager that goes first. So
Yeah.
just understandable that
Yeah, of
they
course.
are under a lot of pressure, and then you get a lot of pressure as well. So yeah, it's all about handling that. But yeah, it can be tough, and sometimes you're mentally exhausted after a game, even though all you've had to deal with was maybe one head injury, but mentally it can be quite tiring. Yeah.
It's amazing, and it's good to see behind the scenes. Nothing is easy in life, right? Nothing where you climb the ladder and you get higher and higher is easy, but that's where your passion comes through. Because if you're not passionate about something, then all these things seem too big in terms of challenges. Whereas if you're passionate about it, you take them as part of the job. And both of you guys seem like you've got a big passion, and you're already doing amazing things. But let's fast forward, say 10 years. If you could think of any sport, any team, any role that you could have in sports med, what would be your top three on that list? Let's start with Naheem.
For me, the dream would be to stay with Millwall and
Okay.
be in the Premier League with them.
Okay, great.
And who knows, play in a European Cup with them. That would be the.
Yeah, amazing. And what about other sports? Is there any sport that you haven't delved into that you think may not be practical, may not happen, but you've always thought, okay, what about that? Would be good to try.
So American football is a big one for me. I mean, it's almost like a dream. If and when we have an NFL team in the UK, it'd be great to somehow be involved with a team. When I just watch the setup and just the athletes and the professionalism, it's really something I'd like to get involved with.
That sounds amazing. What about yourself?
That's a good question. I mean, I wouldn't mind going back into football. I'm quite happy in the amateur and professional boxing setup at the moment. In terms of other sports, I've always thought maybe working in basketball would be cool. But again, there's not much of a basketball following here. A lot of the games domestically in basketball, there's just a physio there. There's often not a doctor. That's a really good question. I think, I don't know. Like, I think.
Well, you're early in your career and you finished GP training not too long ago. Well established and you're already climbing the ranks. But look, I think this has been really, really helpful. And I think if anybody did have some queries about sports med, hopefully this has opened up their eyes a little bit in terms of what's involved, how to get into it, the kind of challenges that are there, perceptions. I think we've covered a fair bit. And if we get some comeback on this and more questions come back our way, I'd love to get you guys back on and go into it in a bit more detail at some point if you guys are good with that.
Yeah, absolutely. It'd be a pleasure.
Brilliant. And before we sign off, Usman, I mentioned your podcast. Just let people know where they can find you on that.
Yeah, so it's the Dr. Us podcast. We bring out 1 to 2 episodes a week on Spotify and iTunes and YouTube, interview sort of various athletes and notable figures. You can find us, you type that Dr. Us podcast, and on social media, it's at Dr. Us podcast on Instagram, Twitter, and Facebook.
And we'll put links to all of this stuff below for anyone interested. Naheem, do you have a secret podcast that no one knows about?
Not yet. But I'm maybe I can do a combined podcast with Usman one day.
Yeah, you guys should do one for sure. 100%. And for guys, those who don't know us, we're at Arora Medical Education. We do GP training, teaching, PLAB teaching, and teaching for medical school and specialty entries. AroraMedicalEducation.co.uk. Please do have a look. But thank you guys for your time. It's been really, really useful.
No, thank you.
And hopefully we'll catch up very, very soon.